All right, we've got a lot to cover today, so I'm going to go ahead and get started as folks join, and we'll cover our introductions. Go ahead and thank everyone for joining us for the second session of the Colorado Coalition for the Homelessness 2023 Education Series. We're doing this on the third Thursday of most months. I think it'll be every month through November. We'll take December off. So thanks for joining us today, and we look forward to hopefully seeing you at future sessions. My name is Alexis Whittam. I'm the Director of Communications for the Colorado Coalition for the Homeless, and we're very excited today to do our presentation. It's essentially Homelessness 101, with a little bit at the end to talk about how to access our services, which is something that people are always asking us. So if we can go to the next slide. Thank you. And then let's go to the one after that as well. So we always want to start with a little bit of housekeeping. Our captioning should be available so that you are able to read captions for anything that anyone is saying in this session. Let's go ahead and make sure those are on, and if folks on our CCH team can get those going, anybody who has that ability. So thank you. Our agenda today, we have been doing some panels lately, but today we're following more presentations. So we're going to be really presenting to you the basics of homelessness, the landscape in Colorado, nationally, even some locally here in Denver, and then some very initial access to services, healthcare, and then into the housing system that we use. So it'll be more presentations today than a panel, but similar to other months, if you've joined us, we'll always have time at the end for a Q&A. And the way that you're going to do the Q&A is there's a little Q&A button at the bottom of your screen. So just go ahead and write a question in there. We're likely not to answer those till the very end. So we'll have 3 presenters, and then at the very end, we'll have 15 to 20 minutes to cover all those questions. Please also feel free to be in the chat, introduce yourselves, chat with each other. But we ask that you please put questions in the Q&A. We do like to inform everyone that the session is being recorded. So if when you submit a question, you have your name there and we read it out loud, this will be recorded. It will be on YouTube. So just for everyone to know that it will be public in that way in the future, just want everyone to know. And then if you are interested in sharing either during the event or after the event, you can use the hashtag CCHEdSeries, and you can reach out to us at CO Coalition. That's our handle on all the major platforms for social media. So reach out to us and let us know if you see any interesting facts. And then, thank you. So our 3 presenters today, we're excited. They all work here at the Coalition. Jacob, I'm sorry you didn't send me a photo. So we have a large teal picture of Jacob, but you can all anticipate what Jacob will look like when he arrives later. Cathy is our Chief Communications and Public Policy Officer here at the Coalition, and will be doing the majority of the presentation about Homelessness 101, and is really an expert in the field of homelessness and advocacy around it, and big picture, what's going on in the landscape. Sean is our Director of Client Access, and so Sean is going to be speaking about access to healthcare here at the Coalition and what we do to serve clients and how clients can access our services. And then Jacob is our Director of Outreach and Engagement, and he'll be talking about a number of programs that he runs, how people get into applying for housing, and then other services that we have through our outreach department. So I'm going to go ahead and hand it to Cathy.
Good evening, everyone. Thanks so much for joining us. I think maybe we should have a competition for folks in the chat about what Jacob actually looks like. What color hair does Jacob have? How about that? As Alexis said, my name is Cathy Alderman. I'm the Chief Communications and Public Policy Officer for the Colorado Coalition for the Homeless. I've been in this role for just over 7 years. I've had the opportunity to do several presentations on Homelessness 101, and I hope that this one is informative for you tonight. I think also, in addition to this recording being available, we can share this slide deck with folks after our event, and we do appreciate you being with us. Okay. So what we're going to cover this evening is kind of what is the state of homelessness, both nationally and in Colorado. What are some of the causes of homelessness? What are the supports for individuals experiencing homelessness? And what are some of the gaps in the system that we are engaging in advocacy efforts to try to address? Some of the things specifically about CCH that we'll be covering is some of our housing best practices, how we're delivering healthcare supportive services and advocacy, And then we'll get a little more detailed about how folks can access those specific services. So people experiencing homelessness, they're our neighbors. They just happen to be unhoused. And the words and the way in which we talk about people experiencing homelessness is really important. It's important that we don't say that homeless person and define that individual completely by their situation of homelessness. It's really important that we look at this as an experience that they are in, and that we aim to resolve that experience so that they can continue to be the thriving community member that they were likely before they experienced homelessness. Nationally, there are 582,000 or more than 582,000 people experiencing homelessness in a single night in January. We know that that number is an undercount, and we know it's an undercount because the point in time count, which is the tool used to collect this number, has some flaws. Of course, there is no perfect way to count the number of people experiencing homelessness, but the point in time is one of our best tools just to give us a snapshot and to help us determine how to use resources. But unfortunately, people that aren't counted are people who may be in jails or hospitals, people who are staying in motels, who might be doubled up, sleeping in their cars. The point in time count depends on volunteers, and it also is dependent upon people being willing to volunteer a lot of personal information about themselves. So we use this as a guidepost, but we recognize that it is certainly not the actual number of people experiencing homelessness. And in our experience, if you multiply that number by about 2.5 or 3, that's going to get to a more realistic number of people experiencing homelessness in the United States. Here in Colorado, the point in time count identified just over 10,000 people on the last count. However, we wanted to share some of these other numbers with you, which are other ways that we try to assess the number of people experiencing homelessness. For instance, the Department of Education over a school year will count the number of students experiencing homelessness or living in conditions that put them on the brink of homelessness, such as being doubled up, staying with friends and families and in multiple locations. And the 2020 and 2021 year, there was over 15,000 students. So you can already see that that 10,000 number is increasing. And then when we look at the homelessness management information system, which is the way in which we enter people experiencing homelessness into a database so that we can help connect them to services, that number is about over 32,000. So again, you can see that number creeping up. And then according to the Colorado Office of Healthcare Policy and Finance, or what we refer to as HCPF, they counted in 2019 over 53,000 people who identified as experiencing homelessness and were using Medicaid as their health insurance. So as you can see, there's a huge variety in how we account and try to figure out how many people are experiencing homelessness. And why is this important? It's important because this is how we determine how to use public resources to address these issues. And this is how we monitor trends in the number of people experiencing homelessness so that we can tailor interventions and programs to address specific needs. In Denver, the Metro Denver Homeless Initiative is the continuum of care, which is the coordinated entity that helps to manage homelessness in the 7-county Denver metro area. And they also looked at specific numbers for Denver. So while the point in time count counted just under 7,000 people on a single night in January, in Denver alone, the HMIS system counted over 27,000. We know that more than 3,000, almost 4,000 individuals went through a vulnerability assessment, which we refer to as the VI-SPDAT, meaning that they were looking for housing specifically. And then there were over 8,000 counted in the Denver public school system. So again, this just gives us an opportunity to think about how many people might actually be experiencing homelessness on that range. And so in Denver, we know it's above 6,000 and could be as high as 27. And I think, frankly, we think it's well into the 33,000. And that's over a year. And we can't talk about the experience of homelessness and the numbers of people in that experience without talking about the racial impacts that homelessness has had. We know that Black and African Americans are 3.6 times more overrepresented in the population of people experiencing homelessness as compared to their prevalence in the general population. We know that Native American and Indigenous populations are overrepresented, and we know why this is, and we'll be talking about it a little bit later, but this is predominantly because we have systems that have had highly detrimental racial implications for these populations. Things like redlining, things like not lending funds to communities of color, for keeping people out of housing and creating barriers to opportunity and better job access. And so it's all of these systems that have led to this. And this is critical when we think about how we address homelessness solutions. We can't just do the things of the past. We have to account for these racial disparities and make sure that we're implementing new policies that are responsive and sensitive to this information. We also know that people have different, they may be in the process of their experience at different places. So we have some people that are accessing shelter. We have some people that are remaining unsheltered. We have some people engaging in supportive services. As I mentioned, there are people who have taken the vulnerability assessment, and so they may be in the coordinated entry process, meaning that they're waiting for a housing resource that matches the results of their vulnerability assessment. And that's what we refer to as coordinated entry. And you can see that there's essentially people just on that waiting list waiting for housing resources. And then we are actually counting people who are in permanent supportive housing and still receiving supportive services, because but for that housing and but for those services, they would likely be back into the cycle of homelessness. So we're going to talk through some of the causes. I mentioned some of these already, but the broken systems. So these are the systems around this that control and mandate kind of how we access services have not always been responsive to the homelessness crisis we're seeing today. We know that people who have experienced generational poverty are more likely to fall into homelessness if they're not already experiencing it. We know that systemic and institutionalized racism and jobs and healthcare access and housing has led to this disproportionate impact that we just spoke of on the last few slides. Our public benefit system has barriers and restrictions that mean some people don't apply for benefits that they're eligible for, or may have their benefits cut off for unsuspecting reasons. And access to healthcare is a huge issue for people experiencing homelessness and can often lead to homelessness. Imagine if you had a healthcare crisis today that you couldn't afford and you had to pay your medical bill or pay for your housing. It can be a very difficult decision to make. But some of the issues that we're going to focus on today are some of the really leading causes that we can put our fingers on. Issues, and that includes the wages haven't kept up with housing costs, especially in Colorado. We have an extraordinarily high cost housing market in Colorado, and it's getting more and more expensive to live here every year. We also know that we just don't have enough housing. We don't have enough affordable housing. Frankly, we may have housing resources available for people at middle and high incomes, but we don't have enough deeply targeted affordable housing for those individuals who need it most. And that can be some of the most difficult housing to actually bring to market because it requires public funding, and there are very limited public funds available. We've also just seen a failure of the federal government to invest in homelessness resolution. And while we've seen some shifts over the time, it's never been to the scale of the numbers that we talked about just previously. I would also say the state of Colorado doesn't have a sustainable funding source for homelessness prevention or resolution. We have some opportunities with some American Rescue Plan Act funds and some one-time investments, but we still don't have a statewide funding source for local governments to access to resolve homelessness at their local level. Some local governments, like Denver, do invest in homelessness resolution, but those funds have just become available in the last few years. And so we just haven't seen the result from the spending of those funds yet. And then we can't talk about homelessness without talking about the dire impacts that criminalization has on this population, and how it can often exacerbate both the experience of homelessness and any opportunity to get out of that experience. So in order to afford a 2-bedroom home in Colorado, you must make over $28 an hour. As most of you know, the minimum wage right now is just over $13 an hour. And while it's a little bit higher in Denver, it basically means that an individual who is working a minimum wage job would have to work 2 full-time jobs just to afford housing. And then the number of homes available to those living at the lowest income. And when we refer to those living at the lowest income, we mean at 30% of area median income. Area median income is a way that we calculate all of the incomes in a general area, and then we kind of find the middle of that pack. And so for individuals that are living at 30% of AMI, we refer to those as extremely low income households. For extremely low income households, for every 100 units of housing needed, there are only 26 available. So that means that 3/4 of the population are not accessing housing that's appropriate for them. They may not be experiencing homelessness, but if they are in housing, it is likely that they are paying more for their housing than they should because they're renting up. On the flip side of that, for people living at 100% of area median income, there is actually a surplus, not a huge surplus, but a surplus of housing. So for every 100 needed, there's 102 available. So this really tells us that when we start thinking about the spending of public dollars to build housing or renovate housing or to get people into housing, we must focus those expenditures for those most in need. And those most in need are those living at the lowest income, at 30% area median income, 50% area median income. And then we have to think too about how people exist within their income bracket. So there are people who are just starting out in the workforce and are working minimum wage jobs. Maybe they're working 1 or 2 to afford housing. And then there are those people that are living on fixed incomes. This is largely seniors and people living with disabilities. And again, people of color and veterans are overrepresented in this population. And we know that this population of individuals, because there's not a huge opportunity for economic mobility for them, are extremely cost burdened. So they're spending more than 50% of their income on their housing costs, meaning that they're making very difficult choices about how to spend their own private funds. We know that Colorado is ranked first for housing instability for older adults. And when we think about older adults, these are often people that are retired. They've already worked. It's not likely that they're going to be able to get back into the workforce. And so we need to be thinking about how to provide housing for those individuals. As we've mentioned, Black Coloradans are overrepresented in the homeless population, and about 7% of Coloradans experiencing homelessness are veterans. So we call these numbers out because each of these populations require just a slightly different intervention in order to prevent them from entering the cycle of homelessness or from helping them get out of that experience. And if we don't think about targeted interventions for specific populations, we're going to be missing the mark. As I mentioned, we just have a dearth of available affordable housing options. So there's anywhere from 123,000 to 225,000 gap in affordable homes for individuals at the lowest income. We also know that as rents increase, so does homelessness. This is a direct correlation. As housing costs increase, we see more people being unable to afford the housing that they're in and entering the cycle of homelessness. We see more people that are in the cycle of homelessness being less able to get into housing because the housing costs are outpacing their ability to save, their ability to make more money. And it's not just the rental market, it's also in home ownership. We've seen a substantial increase in the cost of home ownership opportunities for people. And what that means is that people who might be ready to buy a home have to stay in the rental market, meaning that those rental units aren't going to be available for folks in middle or low income. So we really need to think about how to address our housing crisis across the spectrum. I think I mentioned this already, that the correlation of the housing market to homelessness is pretty clear. But I think what we hear a lot is that there are these other factors that may have a correlation to people experiencing homelessness, but aren't necessarily the cause. So for instance, we hear quite frequently that we need to address homelessness by providing more mental health services out on the street. And that's absolutely true. But that doesn't mean that mental illness is the cause of homelessness. It may be something that comes alongside of the experience of homelessness. It may be the reason why somebody lost their housing, but it is not the underlying cause of homelessness. So while we do need to make sure we're supporting people with mental health services, we can't just blame the crisis of homelessness on mental health issues. People will say also, you know, if you provide more public assistance, you're going to have more homelessness because people are going to choose to enter that cycle and be homeless instead of be in the workforce. And that is absolutely not true. When we started, and we'll be talking about this a little bit later, the Denver Social Impact Fund, we did outreach to 100 individuals who were in the experience of chronic homelessness, had frequent interactions with the criminal justice system. And the first 100 people we reached out to, only one person rejected housing resources. 99% of people experiencing homelessness will take an appropriate housing option if it's offered to them. Like mental health, drug use and substance abuse is not the cause of homelessness. It may be something that someone experiences alongside their experience of homelessness. And often people do self-medicate when they're on the streets, but it's not necessarily the cause. It can be a difficult thing to overcome, and it can prevent somebody from accessing the services and accessing the housing that they need. But it's also a resolvable issue, right? People can enter recovery programs, they can address or moderate their substance use, and they can receive services to resolve that issue along with their experience of homelessness. Poverty alone is not why homelessness exists, right? Somebody may be poor, but we as a country can still provide them with housing if we are smart about how we target public resources, if we build housing for those households that need it most and who have the greatest needs in terms of the income spectrum. And I think similar to the generosity of public assistance, you know, people are not moving to Colorado because we have 300 days of sunshine a year so that they can live out on the streets. That's just not a fact. Despite the fact that you will hear that from, you know, from some people. We do see sometimes variations in the number of people experiencing homelessness throughout the seasons. And we do know that some people may come to Colorado to, less so now, but to engage in what is referred to as the marijuana tourism industry. And they may come for a couple of months because they think it is interesting to have legal marijuana access. But those people aren't seeking out services. They're not looking for housing. They're not engaging with outreach workers to, you know, to help them find a more stable environment. They're here temporarily. And so it's just not fair to equate, you know, those people who choose to move about, you know, the country into different states with people who are actually experiencing homelessness. As I mentioned, our federal government has not invested in homelessness to the scale of the crisis. So we've seen decreases in the investments in affordable housing programs. We've seen decreases in the level of emergency solution grants, which are federal funds intended to address the crisis of homelessness. The Housing Choice Voucher Program is one way that we have been able to assist people who are living at the lowest income into getting into housing. However, only 1 in 4 individuals that qualify for a housing voucher actually receives them. So there again, we have 3/4 of the population of people who were eligible for a housing voucher who can't get access to one and therefore can't get the rental assistance they need to get into housing. And we've seen a decrease in construction of capital A affordable homes. We've seen a big increase in construction of middle income and high income homes, but where we need it most, we're just seeing it's very difficult for the market alone to produce those units. And as I mentioned, talking about criminalization, so everywhere across the country, when a city starts to see an increase in the number of people experiencing homelessness, their first gut reaction is to somehow just make it go away. And making it go away means criminalizing individuals experiencing homelessness. It means conducting sweeps. It means arresting people for petty offenses, because those petty offenses are actually crimes of survival. So they may be, urinating in public. They could be trespass. They could be lying or sleeping on the sidewalk, things that people are forced to do because they don't have a home, things that if they did have a home would not be illegal. And so these criminalization efforts are extremely disruptive to both people experiencing homelessness and the service providers that are trying to assist them. They are extremely costly because arresting somebody time and time and time again is much more expensive than providing them with housing and supportive services. And they're traumatic. They lead to all kinds of mental health and physical health issues for people experiencing homelessness, making it even more difficult for them to get out of that experience. We also know that people do have some personal barriers that can lead to an experience of homelessness. And we do need to talk about the fact that, somebody may have a mental health crisis that causes them to lose their home. Again, it's not mental illness that is the cause of homelessness itself, but it can be an issue for a particular individual. Obviously, job loss, eviction, having a physical disability or a family breakup, all of these things can be reasons why somebody may lose their home or lose access to their home and be forced out into the street. Domestic violence is the leading cause of homelessness among women. And I mean, I think you can imagine for a woman who is trying to escape her abuser, she needs to get out of the house, and there are not enough places for her to go. And then, some substance use disorders really can be tied up in someone's loss of home and loss of stability, especially if they're living with family members who feel like the substance use disorder, has gotten out of hand. And when we talk about homelessness, we always have to talk about trauma. I'm sure you've heard me say traumatic and trauma a couple of times, but we know that trauma is almost always the cause of somebody entering the cycle of homelessness. So all of those reasons from that previous slide, a family breakup, a medical issue, a job loss, all of those traumatic events. The experience of homelessness itself is extremely traumatic. And as these traumas compound, it means somebody is more likely to suffer from mental health issues, physical health issues, move into a substance use disorder. And we know that those things can compound the experience and make it much more difficult to resolve their homelessness situation. So we always have to think about trauma, and we always have to deliver interventions through a trauma-informed lens, because again, as these things compound for individuals, it means that we can't just address the housing instability issues, but we have to also think about the underlying issues that led to their particular experience and how can we help them resolve that. So what are some of the solutions that work? We have to think about homelessness like we think about housing on a continuum. So people are in the immediate experience of homelessness and they need emergency services. They need people to engage with them on the street. They need access to shelter. Especially during cold weather, they need access to emergency resources. We have a lot of people exiting the criminal justice system that are essentially exited into homelessness, and we don't have enough reentry programs to get folks housed right away. Obviously, people need access to food when they don't have a home to store their food in. And then the use of hotel vouchers has been very effective in providing a stabilizing place for individuals. And hotels and motels are increasingly becoming more of a emergency response and long-term response to homelessness. We're also seeing the use of safe outdoor spaces in the same way. The safe outdoor spaces have been a critical life-saving, stabilizing intervention for people experiencing homelessness, but they are not a long-term solution because we do not want people to be living in tents for the rest of their lives. What are those long-term solutions? It's housing, 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 housing. Solution to homelessness will always be housing. But it's not housing alone. It's housing with supportive services. It's housing with access to healthcare. It's housing with case management services so people can reconnect with community. They can get employment opportunities in front of them. They can treat their substance use disorder. They can get access to benefits that they may be eligible for. All of those things that are stabilizing and ensuring somebody will stay stably housed once they get into housing. So the Colorado Coalition for the Homeless, we absolutely believe that housing is healthcare. We recognize that housing with supportive services is the most effective, and we know that we have to be doing advocacy at all levels of government and with our community in order to ensure that we can help people resolve their experiences of homelessness. So on the housing side for the Colorado Coalition for the Homeless, we have 21 properties of both affordable and supportive housing. We house about 4,300 households on any given night. Many of those individuals we don't house in our own properties, but we administer housing voucher programs and we help them find housing in the community, something we refer to as scattered site housing. During COVID, we contracted with motels and hotels to get people into a stabilizing place. So that we could work with them on exiting the cycle of homelessness into permanent housing, not while they were in the chaotic environment of living on the streets or staying in shelter, but while they were in a stabilizing environment like a motel room, which is often transitional housing. Some of the innovations in housing that we've been able to bring to the community include veterans units of housing. So our Renaissance Veterans Lofts at Fitzsimmons is a building 100% targeted for veterans. As I mentioned before, we know that different interventions are more effective for different populations. For veterans at this particular property, we're able to provide targeted case management services, help them build community, address the specific issues, both mental health issues, physical health issues that veterans will have, that might be different from somebody who is not a veteran. And so, through this type of housing, we really are looking at people as individuals, their particular needs, and not trying to just implement a one-size-fits-all. As I mentioned, hotels and motels have become an intervention for homelessness resolution that has been very effective. Our Fusion Studios is a former hotel that we were able to convert into studio apartments. We were able to bring 139 units of supportive housing online in 6 months. It would normally take us about 2 years to build something like that. And so, I think it's a strategy that we've been talking across the state and the country about using and trying to do more of. The Renaissance Legacy Lofts is a new building that we just opened at the beginning or at the end of last year. And this building is really unique because it sits above a recuperative care center. And so this really speaks to our philosophy of the integration of housing and health. So it's behind our Stout Street Health Center in downtown Denver, so people have access to healthcare providers. And for people who need to recover in the recuperative care center, while they're recovering, they can work on a long-term housing option. As I've mentioned, it's not housing alone, right? It's housing with supportive services. We know that people experiencing homelessness, giving them a house key is one step in the process, but many of these individuals have been in the cycle of homelessness for a very long time, and we need to provide those wraparound services to make sure they can stay stably housed. We have proven outcomes from the Denver Social Impact Bond and our new program, Home to Health, which is also referred to as CIPRA here, that shows that these interventions, these supportive services are really critical for housing stability. They're also really critical in keeping people out of emergency services. So during the Social Impact Bond, we released a lot of reports on this, and we're happy to provide those links. But we saw people staying stably housed as high as 86% housing stability rates in some years of the program, and as low as about 77%. But that's still pretty good housing stability rates for individuals that were exiting chronic homelessness. We also saw a huge reduction in the number of arrests because the things that people were getting arrested for, as I mentioned before, would not have been things they would have gotten arrested for had they been doing them in their home if they had been housed. And we also know that the impact on the emergency healthcare system is significantly reduced when people are housed and getting access to regular primary care and mental health services. On average, it costs about half to house somebody with supportive services than it does to leave them out on the streets to cycle through these emergency health systems, the shelter system, the jail system. So we know it's actually better both for community and taxpayers as well as the individual to just provide housing and supportive services. On the healthcare side of things, as I've mentioned, we operate the South Street Health Center, which is a health center in downtown Denver, and we have satellite clinics attached to the health center that are located in shelters. We have a health outreach program. We see just over 14,000 unique individuals through that system. Most of our clients are very low income, and many of them identify as a racial minority. Some of the interventions of why is it important to think about housing as healthcare? Because we know that homelessness is associated with a 15 to 30 year reduced life expectancy. We know that individuals that come to us that may be 40 years of age at the health center for healthcare services, if they've been experiencing homelessness for 3 years or 5 years, it is likely that they will present as a 65-year-old. So their healthcare conditions and the healthcare that's provided to them needs to be responsive to that. People experiencing homelessness are more likely to be the victims of violence and to suffer from traumatic injuries and assault. And then obviously the experience comes with exposure to extreme heat and cold, which exacerbates current health conditions. Some of the innovations that we've been able to provide in healthcare for people experiencing homelessness that we know are successful in kind of getting people out of that experience is really taking a full person approach to our healthcare and provided what we refer to as integrated healthcare, meaning that when someone comes to the South Street Health Center, they can access dental services, vision services, physical health services, mental health services, substance use services. They can get their pharmacy or prescriptions filled at our pharmacy on site. And the idea behind this is it should be a one-stop shop. We need to reduce the number of barriers that people have to overcome just to get access to the healthcare they need to survive. Telemedicine is something that was really elevated during COVID response. This has been a really critical way for us to stay connected with people. We also know that in many instances, medication checks or checks on general health can be done by telemedicine without somebody having to leave their home or come into the health center, which again just reduces barriers and ensures people are getting access to the healthcare they need. We also have a street medicine team that goes out to the streets, meets people where they are, helps to address their healthcare needs. One of the critical components of that is the relationship that it builds on the streets with individuals experiencing homelessness. They know that they can trust the healthcare providers, and so eventually they also may trust other people within the Colorado Coalition for the Homeless so that we can work with them on a housing resolution strategy. Just recently, as I mentioned a few slides back, we opened the John Pravinsky Stout Street Recuperative Care Center. This is going to be a critical resource to the community because there are too many people that are being released from the hospital with healthcare conditions that cannot be resolved or recovered from on the streets or in shelter. So this will give people the opportunity to stay in a safe space and recover from their healthcare condition, whether that's wound care, whether it's recovery from dialysis or cancer treatments. It's people trying to recover within a shelter system on the streets. They're just going to end up back in the emergency room and in the hospital. And so if we by providing these spaces for folks to recover, we're not only helping them obtain better health outcomes for themselves, we can start working with them on a housing stability plan. And then on our supportive services, we see people for lots of reasons in our supportive services program. You're going to hear more about this from Jacob and more about our healthcare services from Sean, but it's really important that we're, again, looking at all of the circumstances that may be keeping somebody in their experience of homelessness, and that we're trying to provide services in a comprehensive way. So that includes, again, outreach services. That includes family support services. So for families that are experiencing homelessness, again, those interventions look a little bit different than they do for an individual. Case management services, helping people connect with their community. housing assistance programs, helping people get qualified for a housing voucher if they are, or accessing other rent subsidization programs. We also want to connect people with vocational programs and employment programs if that's appropriate for them. We know that recovery services are critical for many individuals, and this looks different in our rural communities. And we have a rural initiatives program. We operate the balance of states, and we provide services in 19 of the 54 counties outside of the Front Range. And rural homelessness looks very different than urban homelessness. And so it's really critical that we think about what those interventions are and what's going to be most effective in those communities. One of our I think one of our pride facilities in Colorado is the Frontline residential community, and down in Los Animas, Colorado, which is in the southeastern corner of the state. This is a program for individuals who are experiencing homelessness, also who have a substance use disorder, and they're ready to address that substance use disorder, but they can't do it in the chaotic environment of homelessness, whether that be in the city or in a rural area. And so they can come and stay with us at Fort Lyon for up to 2 years, where we work with them on a recovery plan. We work with them on a housing plan. We often help these individuals get access to educational resources. So we have relationships with the community colleges in the area. Sometimes classes are taught on campus. Sometimes we're able to help people get access to classes off campus. We provide healthcare on site through an independent clinic there, and we help people access the other services that are going to help them be successful both in recovery and resolving their homelessness. And then, as I mentioned, it's critical that we engage in advocacy efforts. We have to do this at the local, state, and federal level. We have to do it with the community, which is what we're doing tonight. And that's the honored work that my team gets to do, the folks that put this presentation together and that have joined us tonight. And what does advocacy mean? It means that we need to be talking about housing. When we're advocating for housing resources, we need to make sure that those housing investments are really focused and targeted to those populations that need those resources most. We also need to protect the limited affordable, and I refer to this as capital A, affordable housing that we have, meaning that there is a market of publicly funded housing resources that could be detrimentally impacted if it's overregulated because it's already regulated by funding sources. We're engaged in a land use discussion right now for the state of Colorado, meaning that we're talking about how do we bring more housing resources to market? How do we build more dense environments? How do we lift restrictions on the types of housing that can be built near transit? And the most important factors for us in this conversation is to ensure that those efforts provide affordability, that they don't displace current communities that are already living in some of these more vulnerable areas, and that there's accessibility, meaning that people living on fixed incomes, people living with disabilities also have access to the type of housing they need. We also engage in a lot of advocacy on renters protection work. Why? Because it is so much easier to keep someone housed where they are currently stably housed than it is to have them enter that cycle of homelessness and have to start all over. And so we've been working this legislative session at the Colorado General Assembly on ways to ensure that people aren't overcharged just for trying to get into housing. We want to make sure that medical debt doesn't count against them in terms of what they can afford for housing. And we want to make sure that evictions are just, that they are for cause, that people can't just be evicted because the landlord has changed their mind, because we need to keep people housed. Housing stability is a critical component to homelessness prevention. We also do a lot of work on healthcare access and reducing the barriers to access, including access to substance use programs. It's just funny, I'm reading this slide. We don't actually want access to substance use disorders, but we want access to the programs that resolve those substance use disorders. This can include reducing barriers to medications, which is often referred to as step therapy, generally increasing access to behavioral health services, and supporting an overdose prevention site, meaning that we will provide a place in a harm reduction way for people to use drugs if they do, so that they can do that in a safe environment and they aren't forced to overdose on the streets. Through our advocacy efforts, we also want to engage our community. We want to inform the community. We want to make sure that people have access to the information and resources that we have access to so that we can, as a community, come together to resolve homelessness. That includes tonight, this education series. It includes the release of issue briefs and reports, all of which you can find on our website. We have a statewide coalition called Opportunity Starts at Home that is really focused on federal policy and really focused on the intersections of everything and housing. So food access, criminal justice, education, disabilities, and the immigration system, all of these issues have a direct foundational relationship to housing. And so we've provided lots of resources on how we can think about housing as a solution to these issues as well. We do tours and presentations. We also do outreach to the community to engage organizations. And then we do a great deal of media interaction. This is just a kind of an example of how our social media has increased over the years, how attention to these issues has increased through traditional media. We're lucky to have an engaged community that is willing to have us send them updates and email alerts pretty regularly by sharing their emails with us. And we want to both react to what's happening in the environment today. So being available to respond to misconceptions or stereotypes that are put out there about people experiencing homelessness, but we also want to proactively tell the community what we're doing, where we're having success, what kind of programs are good, and where we're seeing more troubling signs of increased homelessness. So I now have the opportunity to turn it over to Kiley, who is going to talk about how and what types of healthcare services you can access through the Colorado Coalition for the Homeless. So thank you for joining us, Sean. I'll try to move your slides along, but you can nudge me if you need to.
All right. Thank you so much, Cathy, and thank you all for joining us tonight. You can move to the next slide, Cathy. Thank you. So as you can see here, and as Cathy alluded to, we have a wide range of services that we provide as far as our healthcare services. But before I talk about that, I do want to talk a little bit about our model of care. As Cathy mentioned, we really strive to be integrated care. CCH is an accredited patient-centered medical home, and that means that we provide this diverse range of services centered around a patient's physical and mental health care needs. We really aim to be a one-stop shop and to make those transitions between types of care to be as seamless as possible for patients. An example of how this integrated care would work really well. Let's say a patient came in and their first engagement was with a primary care medical provider. And during the course of the visit, the patient mentioned that they may be struggling with depression. Our goal would be that provider can call in a behavioral health provider right on the spot to do a warm handoff, to meet with the client, to introduce themselves, and to arrange an appointment as soon as possible. Same thing with psychiatry, with case management. So really, we're trying to make those transitions as seamless as possible. So the list of services you see on the screen now, those are all offered at our main healthcare site, which is the Stout Street Health Center. As Cathy mentioned, and I'll get into it a little bit in the next slide, we have some satellite locations. Not all of them offer this full suite of services, but with those sites, we still aimed for those seamless transitions. So even if we don't offer all these services at all of our sites, we try and make sure that our clients can access them as easily as possible. One of our programs that I want to highlight is our medication assisted treatment program. That is a walk-in based program. So we really try and keep it a low barrier access program where we have medical providers who are prescribing Suboxone for those who are struggling with opiate addictions. So it is a walk-in based program. It's very easy for clients to get engaged, and they can come in whenever they need a refill on their prescription. And another thing that I also want to highlight is that we do a lot to ensure that our clients can not only access our services here, but that we are helping them access any services that they might need in the community that we do not provide here. So for example, if a client needed some sort of specialty care or surgery that we don't perform here, we have a team of patient navigators that will assist that client through the process of setting up that referral and helping them kind of navigate through the process. We also do have an enrollment assistance team here that will assist with enrollment in Medicaid and other state programs, or if a client does not qualify for those state programs, we can refer them out to Connect for Health Colorado for marketplace enrollments or some partner organizations if the client needs to enroll in Medicare. So on the screen here, you'll see our various health center locations. As I mentioned, Stout Street Health Center, we refer to it as the mothership. This is our largest site with the most integrated services. We're very proud that we opened the 48th Avenue Health Center, which is based in the new shelter that the city opened up last year. We've been seeing a lot of activity at that site. There are quite a few people with complex medical needs in the shelter system over there, and it really works within our philosophy of bringing services to clients and meeting people where they're at. And in that same vein, we have the Health Outreach Program, which is our mobile medical vehicle. I know somebody will ask, but currently the HOP is experiencing some mechanical issues, so it is not out on the road right now, but our hope is to have it back out on the road soon. And basically we send it out to partner sites, other organizations that are providing services to people experiencing homelessness. We work in close contact with our street medicine, our outreach teams on potential locations where we could make the most impact. Cathy mentioned the Fort Lyon recovery program down in Los Animas. That site also has its own health center to care for the physical and mental health needs of the clients who are staying at that property. And one of the programs that I really want to highlight is the West End Health Center. And you can go to the next slide, Cathy. Thank you. So the West End Health Center is a smaller offshoot of our Stout Street Health Center on the west side of town. It's right on the corner of Colfax and Sheridan. And right now we are operating on limited days and limited hours. You'll see the information there. And part of the reason for that is that during our COVID response, as Cathy mentioned, we mobilized a lot of our care towards working with the city around responding to the COVID-19 emergency and in assisting people experiencing homelessness. So we actually closed down the West End Health Center for almost 2 years. And so we've opened it back up on limited days and limited hours, but I think it's a beautiful site. And if clients have a need for a site that is less trafficked, it's a little quieter, it also has lower wait times. Our hope is to really get people coming back to the West End Health Center so that we can expand our services over there. And as far as how to schedule appointments with us, we really strive to have a mix of pre-booked walk-in and new patient appointments on a daily basis. So we always leave the door open for somebody to walk in and be seen that day with all of our services. But you can also call our main number right there. We recently consolidated all of our health sites to that one main number. So each health site doesn't have a different phone number anymore. If you call that main number through the phone tree, you can schedule an appointment with any of our health sites. And one thing I did forget to mention about the 48th Avenue Health Center, that is a health center that's open to the public despite being attached to the shelter. So if you are working with clients who are on that side of town, that is a publicly accessible health center. And a couple of the frequently asked questions that we hear, and again, the Q&A box is there. So if you have any other questions, feel free to put them in there and we can get to them at the end. But as far as access to service, like I mentioned, we really strive to be low barrier access to services. It's great if a client can bring a photo ID and a copy of their insurance card when they engage as a new patient, but neither is required. If a client is uninsured, like I mentioned, we have that team that can help with enrollment in Medicaid or other state programs. And we also field a lot of questions as to whether or not our services are available to children and teens. We do provide services to children and teens. to enroll in services, they must be accompanied by a parent or legal guardian. We do run a specific pediatric night on the first Wednesday of every month from 4 to 6 p.m. where we really focus on child visits and vaccinations. But for any sick child visits, those can be seen during any of our normal operating hours. But we really focus our efforts on pediatric care on those first Wednesdays. And I will now turn it over to the mysterious Jacob Wessley, and he will be talking about our outreach and engagement services.
Hi, everybody. It's really nice to virtually meet all of you, and I really appreciate you all staying above the fray and not participating in the "What does Jacob look like" chat. Really appreciate that. Yeah, so I'm here to talk about, I'm sure, kind of seeing a lot of you do your introductions, what a lot of you want to know, which is how do you get your clients connected to housing and other case management services that we provide at CCH. So I'm going to do my best to answer that. I'm a big believer in like the active Q&A, and a lot of you have already asked great questions both in the chat and in the Q&A function about services. So I'll go quick to make sure we have time to get to that stuff. So our department is called Outreach and Engagement, like Sean said. Essentially, the way I like to think of us is we're kind of that initial touch. We're on the front lines. So whether it's outreach workers on the streets and under bridges, or our community resources program based out of our health center and our building across the street at 2100 Broadway, we are the people that typically, if someone walks into one of our locations and says, hey, you know, I'm homeless, I really need some help, what can you do? We are the people that they get connected to. So what we try to do first and foremost is, you know, generally we're trying to help them apply and get into permanent housing. We're obviously making sure if they're newly experiencing homelessness that we want to make sure that they know what shelters are out there. You know, sometimes people are asking questions about different treatments, so whether that's, you know, referrals to Fort Lyon, or other sober living facilities, or other inpatient or outpatient mental health or other behavioral health services. And then a lot of other things, you know, helping them if they have residency issues, and then just general advocacy support and problem solving that comes up when you're doing case management with folks. Go ahead and go to the next one, Cathy. So we have a slide all into itself for housing case management, because I would say 95% of the people that access those frontline case management services I was talking about, they want housing, or housing is one of their primary needs that they want to focus on, understandably. And housing gets complicated. I could have filled the full hour just talking about housing, and when I've gone to different agencies and spoken about our services, I do spend a good at least 30 to 40 minutes talking about just all the different types of housing. You know, Section 8, I think, is the most common one that people think of when they think of, you know, a housing voucher. Typically, that type of housing voucher is a housing voucher given through a local housing authority that doesn't come with any case management services, that someone can essentially take and what's called porting out to any other city in the country who has a housing authority that can absorb that voucher, and it's also for life. It's a housing voucher where people pay 30% of their income towards rent. So whether their rent's $1,000 a month, or their income's $1,000 a month and they pay $300, and then they lose all their income, then their rent goes to zero. So it's a really good sustainable housing model whenever someone can get on a housing voucher like that. We won't talk much about LIHTC, low-income housing tax credits. That's something that, you know, people who are working but can't afford market rent, which, you know, who can in Denver anymore. There's apartments that are set up to provide more affordable rents. They're not 30% of your income. They're a little bit more expensive than that. Most of all of our buildings have LIHTC units in them, as are dozens of other properties around Denver. And then HUD 202s and 811s are probably what we do the most of. Those are buildings that are set up to rent to people, again, at 30% of their income. And the qualifying thing is that either they have an identified disability, or they're a senior of age 62 or older. There are some properties that are strictly just you have to be low income to qualify. And again, those charge 30%, but they're building specific. So once you're there, but if you wanted to move, there's no subsidy or voucher that you take with you. And then permanent supportive housing is, or PSH, as we often say at CCH, is what we feel is the most successful type of housing. So that's sort of a blend of the first one, of a Section 8 type voucher with supportive case management that goes with it. So the vouchers for life, as are the supportive services, often definitely in the form of case management, but then often also behavioral health and maybe even nursing support as well. The way you get into that, and we could spend a ton of time talking about this, is through coordinated entry, which if you go to the next slide, Cathy, it talks all about coordinated entry. I'll be honest, to be totally transparent, sometimes coordinated entry feels a little bit more like this left visual than the right visual, if I'm being perfectly honest. It can still feel a little complicated. Essentially, the idea is there's a very limited amount of these permanent supportive housing spaces, either with our agency or WellPower or one of these other agencies that provides that type of housing. And HUD mandates that you have to have a coordinated entry system into that, as opposed to like just picking and choosing who gets in. So essentially, people do this really long, kind of complicated, very personal survey with us that helps determine how vulnerable they are while experiencing homelessness. And then based on those results, they're matched to housing. Again, the housing units are really limited, and then the people completing those surveys are in the thousands. So it's definitely not like a one-for-one type situation. Again, just because we're time limited, I always want to make sure everyone knows these are services that exist. These are services that our case managers provide. As we go to the next slides here, it'll definitely start talking more about how you get access. So definitely like the most consistent way is this Monday through Friday at 2100 Broadway at 8 a.m. If you hear the hesitancy in my voice, it's because there is hesitancy in my voice. It's hard. It's really hard to get access. I'm not gonna, 6 people is not a lot. We, we have, 4 case managers who are able to see folks. And, people's first question is often, well, can't 4 people see more than 6 people in a day? And yes, they can. 6 people is just the amount of new people who typically come through that. Sometimes it's existing clients who are coming back to be seen again. But that's how we intake new people into our program. And then so the rest of the day is spent kind of with follow-up appointments of other people who've previously accessed services through the walk-ins. We just did some extensive surveying with our clients who access the walk-ins, and then also with the staff who provide walk-ins. And we're going through a big quality improvement process to see how can we more effectively provide access to folks. Because right now we have people lining up, at 6 o'clock in the morning to do that. And especially at this time of year, that's not what we want. And so we're trying to find other ways to do that. I always say the best way to access our case management services is through the health center access points that Sean mentioned before. So all of our staff and all the services we described here are all available through our health center. It does, require that someone, yes, is actively engaging in our health center. They do have a provider there. They are getting, care there. But it's as simple as on their first visit, they can just tell an MA, a nurse, a doctor, hey, I also have, some pretty big housing concerns or issues with my food stamps or Social Security benefits. And instantly they'll use this little phone around their neck to call one of us, and we'll pop in the room and get them connected to our services to do our best to help. I also like to always be really honest and just talk about the waiting list to get into housing. Unfortunately, Cathy mentioned the dearth of affordable housing out there that, we encounter so many new individuals, our outreach staff alone. So not people coming to our office, but just our outreach staff reaching out to people who are living outdoors, encountered 1,994 unique people in 2022. And we did manage to house almost 300 of them, which is fantastic. And again, that's just on the outreach side of things. This is not any of the office-based services I've talked about. But as you can see, that's a very small percentage of the people who needed that housing. So housing waitlists can run anywhere from 12 to 24 months, depending on a variety of situations and what the person qualifies for. But we do our best to get them on as many of those waiting lists as possible, in the hopes that one of the ones they're on goes really quickly and they get housed as fast as possible. Go ahead and go to the next one, Cathy. And then this is more of their thing to talk about, but I just have to give a plug. That's a safe outdoor space tent in the background. It's been an amazing resource that our outreach workers have been able to connect people to, and our other department staff. So that's another resource that we can provide people, is if, they're saying that, camping is what they feel to be the safest option for them. We try to help them get into a sanctioned camping spot. So I would definitely encourage you to attend that one. I think it'll definitely be an exciting event.
Thank you, Jacob. Thank you, Sean. I'm going to stop sharing my screen and turn facilitation of the remainder of this event over to Alexis.
Thanks, Cathy. Yeah, so we have a few questions in the Q&A. Thanks for everyone for the robust chat and for putting questions in the Q&A. Jacob, I know you mostly answered this, but Jesse had a question about sort of what is the common practice of, like, what's the outcome typically if someone comes in? I know that you mentioned the different services, but let's say someone comes in, is the common practice shelter placement or hotel motel vouchers? Is there any sort of predictability if someone sends a client or is a potential client that comes in, about what's going to happen if they show up on day one and they get one of those walk-in appointments that you mentioned?
Yeah, that's a great question. So it all depends on the unique situation. And I'm not going to give some politician vague answer here, but that's just my preamble. So because if someone comes in and they're seeking housing, but they're having an acute mental health crisis, or even like we've had people come with, especially this time of year with severe frostbite or other open wounds, what it could look like is getting them immediately connected to a provider, and then, trying to figure out a motel voucher or some other type of very limited resource, but something that's just urgent that we need to get them connected to. It could even mean connecting them to a recuperative care center and trying to get them in if they have an acute medical need that they need to recover from. But most commonly, right, people are coming in without that type of an acute emergency. And so what we're doing is doing a needs assessment. So we're trying to understand, what is it that they need help with? Do they need help getting an ID, birth certificate, applying for housing, all of that kind of stuff? And we always ask if they have any behavioral health needs, so either mental health or substance use needs, because then we have the ability that same day immediately to connect them to a behavioral health provider to talk to them about those services. And then what we do is either the case manager and the behavioral health provider, or just the case manager, will schedule a follow-up visit for that person to sit down with them a lot longer and dive deeper into all of those resources that came up in their needs assessment. So day of, if they need shelter, it'll look like a referral to a shelter. The shelters are close, so depending on people's familiarity, we may even walk them down or something like that. But there's nothing immediate, unfortunately, typically besides shelter for a placement for someone.
Thanks, Jacob. And then as a follow-up also from Jesse, they wanted to know folks with criminal backgrounds that might prevent them from getting into federally funded permanent supportive housing. Is there any, are we able to assist folks? And do you have any suggestions for folks who might be in that position?
Yeah, so, and I'm not just saying this because Cathy's on the call, but Cathy and her team have done amazing advocacy work to make it so that a lot of previous criminal history can't be factored into housing in a lot of situations. However, typically the two main charges that can be like just really huge barriers are manufacturing of meth and sex offenses. And, it's our goal to do whatever it takes to still get those people into housing. So yes, those options are few and far between, but there are options who will house everybody despite their charge. And so I can tell you every single staff member I work with has constantly a couple of those names in the back of their mind at all times. And when we hear about something or a new thing opens up that will work with people with that background type, we immediately are connecting those folks. I'm not saying it's a perfect system by any means. If I was given a large, 7-figure grant tomorrow and said, well, what would you like to do with it? It would be, I would like to house as many people with those backgrounds as possible, because right now they can oftentimes be caught in limbo. So our staff do our best to advocate for them and find as many unique and creative solutions as we can.
Thanks, Jacob. We have a question from Courtney about if there's going to be a CCH voting guide regarding the mayoral election. So I'll give that one to Cathy.
Well, thanks for the question. So we've been putting some information out about encouraging people to vote, but we are not telling people how to vote for a couple of reasons. We are a 501c3 organization, so we cannot take a position on candidates or endorse or oppose candidates. Sometimes we do take positions on ballot measures, but there's not a ballot measure on this particular ballot that we are taking a position on this time. So we won't be doing a traditional voter guide like we have done for some previous elections when we've really explained some of the ballot measures that are coming before voters. But that being said, we highly encourage everyone to exercise their right to vote. And there has been a lot of news coverage about different candidates. I would highly encourage you to access the Denverite and 9 News as 2 really great resources on what candidates are saying about homelessness, what candidates are saying about housing, and take that into consideration when making your decision.
Thanks, Cathy. We have a question from Serena Thomas about from Homeward Alliance in Fort Collins. And Serena's asking about a bill that would waive the cost for state IDs. So I'm going to sort of pose this as 2 questions. One, like in terms of people who don't have IDs, don't have identification, I know that's something that comes up a lot. Either people don't have them to begin with, or they get lost or stolen in the course of homelessness. That's a big issue. So I guess the first part of the question is sort of how do we manage folks who don't have IDs available to them and need to assistance? And then secondly, Cathy, for the second part, we'll ask you about if we'd be interested in partnering on something like that to advocate for some ID legislation.
Yeah, I loved when I saw that question came through because I just couldn't relate more. We spend a huge portion of our annual client needs budget on obtaining identifying documents. And so, yeah, I think finding a way to waive or reduce those fees would be massive. I often say so many of our government systems, which in many ways, right, obtaining, identifying documents is just that we're not built for people experiencing homelessness. Just like the criminal justice systems weren't, like, right, these idea of having to pay fines or pay for IDs or other documents just weren't built with our folks in mind. And so we think any efforts to reduce those barriers and to change those system access points, I think, is huge. So thank you so much for thinking of that and doing it in Fort Collins. And yeah, I would love for us to do something here.
Yeah, I just want to echo what Jacob is saying. We are always looking at ways to reduce barriers for people to access the critical services they need and the essential things that they need access to. So if there is a particular piece of legislation that you are interested in, I'm sure that we would be willing to partner with you, because that's how we spend a large part of our legislative session, is trying to reduce barriers to housing access, healthcare access, public benefits access, all of the things that we know are just compound for people living on very low incomes, people experiencing homelessness, and they don't just compound, but they prevent those individuals from being able to get into stable housing and resolve the issues that may have led to their homelessness.
Great, thank you all. Sean, I think that if we have time for just one more question, some people have questions about walk-ins, and I know you covered that a little, but sort of across our different locations, if someone has a walk-in question, are people able generally to walk in day of?
Yeah, so all of our health centers, with the exception of the Fort Lyon Health Center, do have walk-ins available. Like I mentioned in the chat, we really try and creatively schedule things to make sure that we can meet any needs that present that day. We can't guarantee it. There's variability from day to day as far as how many people show up. But as I mentioned in the chat, we have a pretty high no-show rate for a lot of our pre-booked appointments. So if somebody is willing to wait, we have a standby section where we can pull people out of that if somebody no-shows for an appointment. So we're matching an available provider to somebody who wants to get seen that day.
Great. Thanks so much, Sean. I'm very sorry to say that we are at the end of time. So we got to many questions in the Q&A, but not quite all of them. Rita did have a question about why people don't want to go to shelters. And so that is going to be a large part of what we talk about. Sorry for the technical bit there. What we talk about next month that are alternatives to shelter. So we would encourage everyone who's available to join us next Thursday for that. We are going to have a few experts from the coalition and from partner organizations talking about the alternatives that exist and the reasons why people make the decisions they do, including a peer navigator will be part of it. So we think it's important to have folks with personal experience and close to experience as part of the conversation. So that's going to wrap us up. Just thank you all so much for coming. We know that not everyone takes 75 minutes on Thursday night to learn more about homelessness. And so thank you all so much for prioritizing this and thinking of this and engaging and asking such wonderful questions. All the information here about finding us, our website and social media is available. So please do that. And then, as we said, tomorrow we'll follow up with this YouTube link if you want to share it with anyone. We'll put it on our social media. We'll send you the presentation and a couple of the reports that we mentioned. So, you know, as we head into the mayoral election and people have questions about homelessness, please use our resources. And thank you again for joining us.